Are you serious?
I guess so.
I don't know what do you want me to do?
Can you please?
That is,
Yes, can you tell us
what
the?
is?
I'm sorry.
He's like,
You have
what?
some crazy students.
Okay.
Yeah, I'm sorry.
So what do you want me to do? Show you the parts?
Yes, please.
That'd be amazing.
Okay. So this is the transverse process, which houses the transverse foramen,
Right.
and that's only found on the cervical vertebra. The vertebral artery runs through this, through the transverse foramen. The spinous process on the cervical vertebra is normally split. This one doesn't happen to have it, but most of them have a split. Do you have any other? Well, this one doesn't show it either. Okay.
No, but it's not.
Yeah, here it is. Here's a split. This is very typical. You can see it. Cervical vertebra, but yet the foramen are broken off. This is a real bone, by the way.
Oh, wow.
Wow.
So that's why it's all cracked, because it's brittle. This is called the vertebral foramen for the entrance of the spinal cord. This is the vertebral body. This part is called the pedicle.
The whole section?
This, yeah.
Okay.
This part is called the lamina.
Okay. Okay.
And
So that would be what, like the lumbar?
That's about it.
That's the lumbar vertebrae?
this is cervical.
Cervical.
I mean, lumbar.
Lumbar, okay.
Lumbar.
Cervical is the one with the split.
Right.
Like this one.
Right.
Okay.
That's and then the big one is the lumbar.
Lumbar. And what parts do we have to know from the lumbar?
Well, they're all the same basically. You just have to
The
distinguish it.
smaller.
You know, that has the big body,
Right.
Because we're holding a lot of weight.
But you would use that one on the exam, right?
Yeah. They'll be separate. It won't be tied together. Okay, what else do you want to know? The atlas and axis?
Yeah.
Yes.
Okay, this is C1, commonly known as the atlas.
Uh-huh.
It does not have a spinous process, as you can see. It does have the transverse foramen for passage of the vertebral artery. It has this very large articular surface which articulates with
Skull. Oh,
the
condyle.
occipital condyle of the occipital bone of the skull.
Right.
So this is referred to as the inferior occipital condyle. I'm sorry, the superior occipital condyle. This is the inferior occipital condyle. And they articulate together and allow for the skull to rock back and forth
say
with the
yes.
yes motion.
Is that the
See,
intervestibular notch or no?
the what?
The intervestibular notch?
The intervertebral? No, I'll show you that.
The other one is
C2 is called the axis, AXIS, and it articulates in this fashion. The projection is called the dens, and it's held in place by a ligament that goes from here to here called the transverse ligament.
It goes across, right?
Right.
Okay.
When these moves, they rock side to side, giving you the no motion.
no.
Great.
What else do you want to know?
And this one is the
Cervical.
cervical. And for the cervical, what do we need to know? Technically the same thing, the body.
Oh yeah, they're all basically the same
The
with slightly
body.
different features. So
Yeah.
this has the transverse. On the thoracic, you have the transverse costal facet right here. So we have here's the rib. So before I do that, let me show you the rib. You have a blunt end on the rib. and a tapered end. The blunt end attaches to the sternum. The tapered end attaches to the thoracic vertebra. So, the tubercle of the rib has an articular surface. You can see it here. That connects to the transverse costal, because costal means rib, facet, like this. And then the demifacet over here attaches to the, like this, to the end part of the rib. So you have two articular surfaces. You have the transverse costal facet here and the demifacet here. And they both connect to the rib, holding it in place. Anything else? Any other parts?
And for this one, you said we have to know this area,
Okay, this is the sacrum.
sacrum.
So this is the posterior, this is anterior. Posterior, you have the medial crest
Crest.
and the lateral crests.
Okay.
There are 8 of these. They're called sacral foramen.
Sacral foramen.
You have on the lateral side this large articular surface which articulates with the
Pelvic bone.
pelvic area. On the anterior surface, you have the transverse lines.
Which
So
is
there's
three of them,
Three
right?
of them.
Okay.
That's about it.
And for the coccyx, we only need to know that.
Yeah, I
It
never
attaches to the
really
apex.
asked on that.
No. Okay.
You know this bone?
Mandibular.
Okay, so this is called the head or the articular surface. It articulates with the temporal condyle of the temporal bone to form the temporal mandibular joint, TMJ. This projection for muscles is called the coronoid process. This area is called the mandibular ramus, R-A-M-U-S. This is the angle. This is the body,
Okay.
mental foramen, and the teeth sit in the process called alveolar process.
Alveolar process.
Yeah.
Okay.
Right. That's basically that.
Thank you.
What's that?
Should I get the baby skull?
What's this part of the skull called?
That's the frontal? That's the frontal one?
No, but the top has a special name.
Anterior frontalis?